Hello, hello. I hope everyone is doing well. I wanted to film a quick update on my latest surgery, my third surgery. If you are just finding this for the first time, I have several videos that kind of go through this year of my life. My name is Rebecca, and I was diagnosed with stage 3 HER2 positive breast cancer at the beginning of the year. And I finished my chemo regimen, and I had a bilateral mastectomy. And in July, I had my bilateral mastectomy. And then August 14th, I had a second surgery to remove some necrosis out of both sides and to replace both expanders. And on Tuesday of this week, I actually had a third surgery because my right side was not healing again and had some necrosis and needed to be addressed. So if you watch some of my videos that I filmed the last few weeks, I kind of go more in depth into what those complications were and the risk going into the surgery this week. My last surgery, I tested positive for staph, and on both sides, and there was some concern about how that would impact future surgeries. So on my last video, I mentioned that I was going into surgery and I didn't know what to expect to see when I came out of it, because I didn't know if they were going to remove the expanders and just close me up to be flat until after I finish my cancer treatments, or if I would wake up and have a new expander. So I kind of went into the hospital on Tuesday really not knowing what was going on. And I think one way to really, that really showed the stress that I am under was my blood pressure. I typically have very low blood pressure. I mean, if it's not low, it's always at normal, but I usually have low blood pressure. I'm not really sure why. When I was going through the last 2 chemo cycles, they were really paying attention to it because my blood pressure would be like 100/60 or low, I mean, it was lower than that. And they would be really worried about what was causing that. And I think I was just so sick from the chemo. And I was okay. Obviously, I'm still here, so everything was fine. I'm saying that because my blood pressure at the hospital was 140/90, and I've never seen that before. It's never been that high. I think it was high the first time I met with my oncologist, and it still wasn't that high. And obviously the first time you meet with an oncologist, you've just found out you have cancer and your whole world has been rocked, and so you're a little bit stressed. So I was going into the hospital this week after, multiple surgeries and the hardest year ever, and just not really knowing what to expect. So I really feel like that was why my blood pressure was high, not because I'm unhealthy or anything. Anyways, so that was just an interesting little thing that happened while I was there. When I went in, it was the hospital system that my plastic surgeon is with has 2 hospitals. So my first 2 surgeries were at a different hospital than the surgery I had this week. And that's just interesting to note that different facilities look different. They handle things differently. The information you get is different. I liked the pre-op area better because they allowed, both my parents were there. My husband was having to take care of all of our kids, so we were communicating via phone. But both my parents were able to come back and sit with me. And then I'm pretty sure I was kind of drugged out at the very end, but pretty sure they were both in that same area when I came back. So that was nice. That was a nice feature. It makes you feel comfortable when your people can be there with you, when your parents can be there with you. That's good. But also, it seemed a little disorganized with the people coming in, the different teams coming in, taking different tests and samples and asking questions. And it just wasn't the same kind of flow as the previous hospital. And when you're already kind of on guard, that seems a little bit weird. There were just some things that happened with paperwork that I had questions about. So at this point, it's my third surgery and I wasn't taking any chances. So, I was writing on these pieces of paper that they wanted me to sign. I was writing, what I knew. For example, there was a form about what procedure you were having done. That seems simple enough, right? Well, they didn't have the accurate information on that form. And they wanted me to sign a 4-page document. And I wasn't going to do that without making sure that the right information was on the document. For those who don't know me, I do actually have a JD. I'm not practicing. I'm in economic development, but I know enough to know that when you're signing something, it needs to be accurate, especially in a healthcare facility. And so there was a little bit of confusion about that. And I think that's one of those things that, you're always having to advocate for yourself on so many different levels, and that's one of them. Another form that they had me sign that I also wrote on was a consent form regarding payment of services with insurance. And the reason why this was such a big deal, I don't believe I talked about this on my previous video, but my surgery got scheduled very quickly. I had gone into the office to meet with the nurse practitioner on Monday. They realized that I had to have surgery. It was scheduled very, very quickly for the next day. And so all of the pre-authorization for the insurance had to take place very quickly. And I had multiple conversations with different people from the hospital regarding anesthesia and pre-registration and deductibles and all of those kinds of things. And then at around 3:00 on Monday, I got a very rude call from someone in another part of the state telling me that my pre-authorization had been denied. And it's a much longer story than that, but and that I was going to have to sign a consent form saying that I would be responsible for all of the procedures. I was like, well, that doesn't make any sense other than the fact that it's being rushed because I have very good insurance. Everything should be fine. So I ended up having to go through in a very short period of time and get to the right person at my insurance company and talk to the nurse approver to make sure that everything was approved, and it did get approved. And I had an approval number and all of that kind of stuff. So I wrote that on the consent form saying, this is the approval number. This is the time that it was received. This is, the date that it was received. And so anyway, so you have those little hiccups, like administrative hiccups. And I only mention that because, they all add up. All of these little hiccups, all of these little contradictions add up. And when you're trying to heal and survive and thrive and all of the things, those details really impact your mental state or my mental state, my parents' mental state. I mean, I think we're all just kind of tired of having to always be on guard. And I think we always will have to be on guard. And, yes, we will. It's just disappointing. So anyways, so that happened. We got the insurance stuff figured out. I mean, I had the form figured out. I'm not going to go into more detail about that, but it got, all of that worked out. Another thing that happened that was just very interesting to me was the fact that I had a bilateral mastectomy and I had lymph nodes removed out of my right side. So I can no longer get my blood drawn or have IVs or have my blood pressure taken on my right side, if at all possible, because that can impact, I think, lymphedema. But that was something that, that my actual breast surgeon who got the cancer out reinforced, and so did my oncologist. So yesterday, it wasn't yesterday, it was on Tuesday. Today's Thursday. Yet on Tuesday, when I go in, they have a sign on the bed rail saying no blood pressure on your right side. I have a wristband that says, something about limbs, like don't touch the side. And we had to kind of reinforce that with the folks that were going to be in the operating room, even before I got in the operating room. And then when I did get in the operating room, I was still awake. And so they pulled out that right arm and had me put my arm out. And I was like, well, you do realize you can't touch this arm. And the second I said that, she dropped that. She dropped the right arm and they started working on my left arm. And it was just one of those things, like, what if I had been asleep before then? Even though there was a pink wristband on my arm saying don't touch it, just those things, you just have to be constantly vigilant. And, so that happened. I did meet with my plastic surgeon right before the surgery, and, she looked at both sides. She did make the comment that the right side didn't look as bad as it looked in pictures, because remember, I hadn't seen her. I only see her in surgery. So the nurse practitioner had sent her a picture on Monday. She said that it didn't look as bad. What was interesting that she did say that I didn't know was that my expander was visible. You could see it. She could see it when she was looking at it, but I never saw it, but I also don't really look at it that closely. It freaks me out, and that's a personal decision, I guess. But, so she looked at it. She marked it up. She actually looked at my left side and saw where there were some issues with that incision. And so she started marking that up and said that she was going to have to go back in and not replace the expander, but work on that incision area, which is what was left off of the form that I wrote back into the form, because that needed to be identified. We talked a little bit about what it looked like post-op, and this is where it gets kind of interesting again, because she told me that, she put me in a surgical bra that you can kind of see, like right here is what a surgical bra looks like. And that I would be able to take a shower after 48 hours, and that the bandages that would be on there are waterproof. And then she was like, you'll go and see the nurse practitioner on the following Monday. But we were ready for that because Monday is Labor Day. So she goes, okay, well, then you'll see her the next week. And so we make the comment, when I say we, my mom is in there as well, and my dad's in there. And we're like, but I've never gone this far without having a post-op appointment. That's going to be almost 2 weeks. And she just acted like that was okay. And we kind of pushed back saying, listen, at every post-op appointment that we've been to since my first surgery, there has been a complication that presented at that first appointment. Is it okay that we're going that long? I mean, it makes us a little bit nervous. And she said it was. She did push the shower back to 72 hours. It's very interesting because on the surgical notes, it says that I can wear my surgical bra if I wish. The ones from the post-op nurse says that I should always have a sports bra on. From the experience of the last 2 surgeries, my nurse practitioner has always told me not to wear one after that first post-op appointment. So I have only worn the surgical post-op bras, and only for a week, if that, after the first 2 surgeries. So now it just seems like there's a lot of contradicting information. I've been told not to take showers. I've been told to put Aquifer on the incisions. The doctor said not to put Aquifer on the incisions, to just let it go. And so we're going to do what the doctor said. That's what I'm going to do. But I don't necessarily feel great about it because I feel like, once again, I'm getting different information from different people, and it is very frustrating. So I'm very much frustrated by that. What I will say is that when I woke up, I was in that recovery area where they're monitoring you, and they give you more drugs if you need them, which I did because I woke up, and what I did not feel from the first 2 surgeries, I did not wake up in pain. I woke up in pain for this 3rd surgery. And I hurt really the rest of that day and all of yesterday. Today I'm sore. I'm not in pain, but I did not really have the pain. I had like the uncomfortable feelings that you get after surgery, but it wasn't painful. But it was painful after surgery and yesterday. So that was interesting. I have pain medication that I can take. I don't really love taking it because, I have small kids and I don't want to get addicted to anything or reliant, or I don't have to rely on medication. I don't like swallowing pills. And I've always been like that. So I just don't really love taking medicine if I don't have to. But I had to yesterday and last night to sleep. I haven't taken that kind of medicine today. So there's that. I woke up in the little area, and the first thing I said was, do I have expanders or not? Do I have boobs or do I not? Because I didn't know. And I did. So that, I guess, is good as long as they heal. From what the doctor told my mom over the phone when she called her after surgery, and from what I see in my chart, they removed more skin from my right side and washed it out and put a new expander in with air. They also, I think, removed skin on my left side, and I had a moderate seroma on my left side, which we did not realize, and they closed me back up. They did not take that expander out. They kept that expander in, but she sent that seroma to get cultured. I guess we're a little concerned about why they didn't take cultures from both sides, because both sides tested positive for staph last time, and the right side was the reason I was coming in for surgery to begin with, and it wasn't. We didn't know if it was infected or not, so I don't really know what the rationale is for that. I believe my mom asked the surgeon, and she was told that wasn't a concern, and there wasn't really a clear explanation. So hopefully everything is okay. I will say that there is no way that I'm going to be able to keep this surgical bra on until September 9th because it's painful. It is very, very tight along the incisions, and I'm just not going to be able to do that. It's very uncomfortable. And honestly, I don't know if it's like the wrong size or what, but we'll just have to figure something else out because I'm super paranoid now about this failing again. So hopefully it doesn't fail again, and hopefully everything goes well. I mean, she said that everything looked like it was going well, and that I'll heal. When we asked why it kept happening, why the necrosis kept happening, the surgeon said that, it has to do with blood flow, and she didn't make any promises that it wouldn't do it again. She said, that this was, from her experience, normal. And, hopefully this time it will work and we don't have to go through this again. So I don't know. I'm over it, but I am relieved in some way that I didn't lose them both, and that there is still some shape to me. If it fails again, I'll be pretty upset because, I did mention just take them out because I don't want to keep having surgery. What we do know now that she confirmed is that we'll have to push radiation back another month, and going to the lymphedema physical therapist, we'll have to push that back a month. And that is discouraging, especially the radiation. I will also have to push back my echo. I think I may have mentioned that before. But it just pushes everything back again. So hopefully this heals. I'm just praying that it does, and we can get through it. So I just wanted to give a quick update. And, these videos it's easier for me, especially for folks that I know, like friends and family. It's easier for me to kind of give these updates on this format on YouTube or on a video than it is for me to call and have individual conversations with people. If you really know me and you really love me, you understand that. Like, I can't have the same conversation over and over and over again. It is exhausting, and it's just hard to keep talking about. So I'm really grateful that I have this platform for a couple of reasons. One, because I have so many people that have reached out to me that have gone through this, that I have no idea, that live somewhere else in the world or in another state. They may be younger, they may be older, and they are able to kind of hear me and my concerns and share their experiences. And sometimes their experiences are worse than mine. Sometimes they're better. And I really, it's helpful to me to just have like that camaraderie with other breast cancer survivors. And it's easier for me to kind of get this out to my family and to my friends. So I appreciate y'all bearing with me on that and understanding that I don't always return calls, and I don't always return text messages and things like that. And it's just really because life is crazy right now. When I am home and I am able to, interact, it's really important for me to be present for my kids and my husband, and with my parents. So, and my parents and my husband, they're filling people in too, and I appreciate that. So, so I just kind of wanted to throw that out there. Don't take it personal. If you know me, don't take it personal. Even on the YouTube comments, I try to respond, but to folks that I don't even know, but I don't always, because I just don't have the bandwidth sometimes. One of the things that this whole situation has done is, I am tired, and in a way that I cannot explain. My energy level is not as high as it normally is. And I have a lot of responsibilities in my life that I have to kind of juggle around all of this. So I'm just stretched a little bit. So just know that, and know that I appreciate, all the prayers and all of the comments and messages and things. I see them. And at some point through this, I will get the stamina back to be more consistent with responses. But just thanks for understanding that. So Like I said, my follow-up appointment to this is on September 9th. I will probably film a video between now and then, kind of giving an update on where I think I am, because it's going to be a lot longer in between post-ops. And if anything else comes up, I'll do an update. But for now, that's how my surgery went. It went well, as well as it could have gone. And yeah, it's just one more surgery to check off. So hopefully that's the last one until all of this is said and done and I get the real implants. So yeah, all right. Well, if you're watching this and you're not subscribing, please subscribe. It'll notify you when I do an update. And I appreciate you following along for everyone that's watching. All right. Have a great day. Bye.